She's assistant professor in ethics and technology at Delft University in the Netherlands. She serves as a member of the advisory board for AI and Intelligent Automation Network and is head of the 4T Center for Ethics and Technology Robotics Task Force. She is author of the book Healthcare Robots, Ethics, Design, and Implementation, and has been awarded NWO research study on how can we responsibly design service robots. She is co-founder and co-director of the Foundation for Responsible Robotics and is on the board of the Institute for Accountability and Internet Democracy. 2 weeks ago, she was awarded and named the 2018 L'Oreal UNESCO for Women in Science Laureate. I present to you Aimee.
Thank you. What a wonderful way to come on stage. Just to start things off, what I wanted to say is I ask a very different kind of question in the robotics and artificial intelligence space. So we heard a little bit this morning about all of the different kinds or things that we can do with technology, right? We can do this. And I ask the question, should we do this? So it's a different kind of question, not always the favorite for the technology implementers and the developers, but I think as we've learned today in the space to be creative, it's a very necessary question to put on the table. So just starting you off, that's where I'm coming from. What I will do in the next hour is briefly say something about my background, also to give you a vision of where I'm coming from with the message and the story that I'm trying to tell today. And then I want to say something briefly about ethics, what it is, so that we're all on the same page, because I'm also learning too about the audience and trying to grasp, has everyone done their Philosophy 101 course, their ethics course, but better just to make sure that we're all on the same page. And then I would like to finish the presentation with a discussion of ethics for innovation. And I feel like this is an incredibly important moment to have a discussion about ethics for innovation because I'm not sure too much about the narrative here in Canada, but over in Europe and in the United States, from what I know of, there's this vision of ethics as being, the voice that stifles innovation. It takes so long, you're slowing things down, right? The mantra in Silicon Valley is move fast and break things. And ethics doesn't quite allow you to move fast and break things. So there's this vision of ethics and ethicists as being, this hand being held up, or I like to give the image of, wagging your finger, why did you do this, what's going on? But what we need to do is to change that narrative. And instead of looking at ethics and ethicists as the ones who are always saying no, we need to now start to use ethics to inspire innovation, to take the values and the principles that are at the root of ethics and to use those to create the technologies, both in the actual core capabilities of the technology, but also in the way that they're implemented. So if there's one take-home message that I can leave you with today, it's this idea of changing the message of ethics and ethicists from one where it is, don't do that, what have you done, to let's use ethics to inspire innovation. So to give you a little bit more input or insight as to my background, I actually have a background in cell biology. So I'm not the typical ethicist that you might encounter. I did cell biology over at the University of Western Ontario. Yeah, Mustangs. I know there's one Western student in the room. Woo! So when I was studying cell biology, though, I was also working at CSTAR. I'm not sure if anyone is familiar with CSTAR, Canadian. Oh my gosh, this is the first time I've had an audience where they say yes, yes, because over in Europe, we're still learning about all of these institutes. But CSTAR, Canadian Surgical Technologies and Advanced Robotics, and I was working with Dr. Schlachta, the medical director over there. And I was on the first team that was working with the Zeus telesurgical system and the first team working with the Da Vinci surgical systems. And we were training surgeons how to actually use the robots before they went into the surgical suite. And we were also trying to test whether or not we could introduce a delay, a latency, or a variation in that delay, and whether or not the surgeon's performance would be impacted by this. Of course, we did not do this on any human subjects, right? These were all dry lab experiments, and sometimes we did animal experimentation. And it was this experience, really, I had all of these discussions with the engineers, and I spoke with the surgeons who were in the process of training, and I kept asking them, how do you feel about this huge piece of technology that you're now sitting behind? So instead of touching the patient or even leaning over the patient, if you're talking about laparoscopy, you are in the other side of the room in the surgical suite. What is that doing to you? They sort of thought, yeah, okay, I hadn't really thought about it like that. And I asked the nurses, what is this doing to you in your role, in your job? And the nurses were explaining to me that now they had some new requirements of their job. They now had to teach the family members how to take care of the patients at home because they were going home so much faster. So there was this new dimension for them. And I was asking the engineers, what are we going to do about that? Does that come into the evaluation of the robot? Does that become a part of how we decide if it is good or bad? And no, nobody was asking these questions. This is the early 2000s. We were just excited about the technology. And so it was that experience that led me to say, okay, I think there is space to ask these questions, and I'd like to move forward with that. So I moved to Europe, and I began my career in academia in this newly developing field, robot ethics. So it's really only been around since about 2005, 2006, where we started to take ethics, ethical theories, and apply them to the technology of robots. So I did my PhD in healthcare robots and the ethics of healthcare robots, and these weren't necessarily surgical robots, but robots that would be used in the role of the nurse, right? Lifting robots, bathing robots, feeding robots, these kinds of robots. And then I've since sort of breached out or stepped out from the healthcare context specifically, and I'm looking at the service robot industry, so robots in humanitarian context, robots for delivery, sex robots, which, believe it or not, is actually a thing. And they're providing a service of some sort, and we may be having conversations about them in the healthcare context sooner rather than later. So I have this role in academia where I'm trying to investigate and study what are the ethical issues that this technology is confronting us with. But I've also found that there are certain limits. I mean, the freedom of academia is wonderful, so please don't get me wrong. But there are some limits that you present a paper at a conference or you publish it in a journal, and oftentimes it doesn't go much farther than that. And I was struck by my experience at C-STAR, but also the numbers of these robots being sold, right? $1.9 billion in 2017. So this is a growing industry. I didn't think that a publication was going to cut it when it came to ethics having an impact. So myself and Noel Sharkey, who is an expert in artificial intelligence over at the University of Sheffield in the UK, he and I started the Foundation for Responsible Robotics just about 2 years ago. And the idea is we are trying to bring the work that's happening in academia to industry. We're trying to raise awareness of the general public and also to help educate policymakers, all with this goal of stimulating the reflection on responsible robotic development, design, and use. Now, at the same time, so that's in the robotics space, I'm also on different boards of NGOs, but I'm now newly appointed to the European Commission High-Level Expert Group on Artificial Intelligence. And that'll be important when I get onto the talk later on. But there are all of these different things that are happening in Europe. And I know in Canada as well, you have the Toronto Declaration, the Montreal Declaration for Artificial Intelligence. Wonderful to see these initiatives. But we're at an exciting time right now where policy needs to be created. We need governance structures, and this is where we need as many voices at the table as possible. So what I'm trying to do in all of the different places that I'm working in academia and also in the NGO world and the policy world is really to promote the ethical design, development, and use of robotics and artificial intelligence. It's my main sort of goal. So what I'm going to do then in the rest of my talk is to bring some of the insights from the European context to the Canadian context, as well as some of the insights from the ethics context to the healthcare practitioner, the doctors and healthcare practitioner. Is that the right distinction? No, the wrong distinction. Okay, so first, in true academic form, what I'm going to do is break the question apart. So if we start with the question, what are the ethical issues related to robotics and artificial intelligence in healthcare? we have to understand what it is we're asking. So we start with, what is the technology that we're talking about? Now, many of you, I would imagine, are familiar with surgical robots, Da Vinci being the most common at this time, but there are a broad spectrum of different technologies that we see in healthcare. The tug robot and the helpmate robot are also robots that are quite common in the North American or in the United States context. These are used for delivering sheets and medications throughout the hospital. Is this new? Are these new for anyone, or this is common? People, yeah, in Canada are also, the hospitals are also using these robots? No, okay. Sometimes, maybe, sometimes, okay. So that's, I mean, that's really great to know. Okay, but so these are pretty common robots over in the United States context, and they are used for delivering things around the hospital. So they are not meant to be companion robots or social robots in any way, shape, or form. They are very much how they look, instrumental. They're providing a service to the healthcare practitioners in their daily roles. And then you get into some more social or companion-like robots. These robots look very different. They also have very different capabilities. This is a robot called Huggable, which has been developed at MIT University over in the United States. And the idea with this robot is to help alleviate some of the anxiety that children experience when they're in the hospital, whether that anxiety comes from preparing for a surgery or taking their medication from day to day. The idea is that the robot will sort of lighten the mood, if you will. Future versions of this robot will also be able to pick up on physiological cues so that they can adjust their behavior accordingly to how the patient is responding. So that might mean this patient needs certain relaxation right now, or an alternative patient maybe wants a joke. Maybe we need to get the energy going a little bit. So much different from the previous robot that I just showed you. And then you have exoskeletons. So exoskeletons are traditionally used in the rehabilitative setting. This is a robot that you wear, and it displaces the weight so you don't actually feel the weight that you're carrying. These are also quite common in a military context. So soldiers are able to carry a much heavier load than they would be if they weren't wearing the robot. And they have recently been suggested to be used by nursing or porter staff to help with lifting patients. So again, one of the burdens that nurses, of course, I don't have to explain this to this group, but it's suggested that this could alleviate the burden of lifting patient after patient after patient without fully removing the nurse from his or her role in the caring practice. And then you have other versions that aren't mobile, right? Aren't traveling throughout the hospital, but are still intended to provide a companionship or social-like role. This is Meibu. This is a pretty new robot by Corey Kidd, who also went to university at MIT, working under Cynthia Brazil, who is the big social robotics guru. Anyway, this is one of his latest projects, and the idea is that you interact with this touch screen. The robot can also speak to you at certain points, but it's all based on the sort of chatbot function that is on the touch screen. But it goes beyond the chatbot in that it is actually embodied. And then you have strictly chatbot applications, right? Where we're talking about the interaction between a patient and a healthcare provider or a healthcare system through a smartphone, or it could also be your computer. Conversa is one of the leading companies right now over in the United States that is running the development of these kinds of chatbots. There's a whole range of them. Conversa is just one of the examples. And then you have a sort of hybrid in between the embodied robot and just the chatbot, which is a conversation that you're having on the screen, and you can have an avatar. So this is not a human-like person, this is a picture, this is a virtual representation of a person. So the reason why I show these different examples is also to introduce defining criteria for what we're talking about when we're talking about robotics and artificial intelligence. On one side of the spectrum, we have this embodied technology, the surgical robot, the delivery robot, the huggable robot, this thing that is present in our world that we can touch, that we can interact with in a very, sometimes intimate way because it is a part of our environment. And then if you move down on the spectrum, you have avatars. You're still interacting with it. It still resembles a human in a certain sense of the word, but you certainly can't reach out and touch it. It's not embodied in our environment in the same way that a robot, qua robot, is. And then if you move even further down along the spectrum, this is where artificial intelligence comes in. So it's important that we don't confuse the terms and think that robots are artificial intelligence. AI is software. It's algorithms. Algorithms that are really good at making predictions. So they take large, copious amounts of data, and based on this data, they can find patterns and make predictions about people's behavior or future events that might happen. AI can be embodied in a robot, but it doesn't need to be. It can just be a software that's operating on a system. And a robot doesn't need AI. It can be human-operated, like a surgical robot, or it can be autonomous in that it just follows a pre-scripted plan, okay? So now we have an idea of the technology that we're talking about, but going back to this question, what are the ethical issues? What does ethics mean? What does it mean to say, what are the ethical issues? And of course, why is this important? Well, we've seen, now I'm not entirely sure of the narrative here in Canada, but in Europe we have pretty strong publications coming out presenting a dystopian or a utopian picture about robotics and artificial intelligence in the healthcare system, in general, but in particular in the healthcare system, and conjuring this language of it's unsafe to use these, or we overtrust these, or it's going to improve, they're going to be better decision makers, right? We heard this morning that the AI is better, and then we have to ask, what does this actually mean? And then we get into the more nuanced discussions about safety or data security issues when it's private companies that are in control of our data and not public institutions. So, what is ethics? Well, what all of these issues have in common, all of these newspaper articles and clippings, they're all talking about the public good. They're all raising concerns about something like privacy. Privacy is a value that we hold dear to us. If we don't have privacy, we might not feel as though we're experiencing a good life or that our public goods are taken care of. So all of these issues that we hear about in the media are related through a common thread, which is ethics. And ethics is essentially the study of the good life. Right? This is one way of articulating it. You also have ethics as being, how do we be good people? Or how do we be a good citizen? What is the right action to do? But essentially what it all boils down to is, ethics is the study of the good life, what it is, and how we can achieve it. And we use very specific language when we're talking about this. We talk about rights, that you have rights to certain things, freedom of movement, freedom of expression, freedom of opinion, right? Ethics ensures that your good life looks in this way. We use the language of values like privacy, I had already mentioned, or security, safety, well-being, whether it's physical, mental, psychological. So ethics uses this language in order to paint a picture of what the good life actually is. And ethics isn't immune to technology. I mean, the two aren't mutually exclusive, right? We can think already of multiple examples where technology has an impact on our vision of the good life. It could change a requirement of the good life, or it could just change how we get to the good life. So if you think of something like the internet or your smartphone, can you imagine being without your smartphone for a day or 2 days or a week, or not having internet for a week? Has anyone tried to do that lately? The anxiety that you get, right? That you don't have access to my phone. My phone doesn't work over here, and I have to say, for the last week that I've been here, it's been refreshing on the one hand, but definitely nerve-wracking on the other hand. But that's an example of how we've become so dependent on a technology, but it's also changed a component of the good life. Our good life is shaped. We have this idea that if we have access to this technology, if we can be connected to the rest of the world, that has become a part of how we describe the good life, what it means to us. But then there's another way that technology impacts the good life, and that could be by not changing a requirement, but just helping us to achieve a requirement. So if you think of something like relationships, family relationships or personal relationships in general, these are, this is an important quality of the good life, what it actually means. But in this globalized world, I live very far away from my family. People are scattered. how do we maintain some sort of connection? How can we not necessarily start new relationships, but maintain other relationships that are important to us? And technology can help. You have WhatsApp, Signal, Google Hangouts, all of these different online social networking sites that allow us to stay connected. And so this is an example of technology not adding a new component per se, but allowing us to achieve a component that has always been there. So technology very much plays a crucial role in this conversation of ethics, in this conversation of the good life, what it is, and how we can achieve it. And robotics and artificial intelligence is the same. It will change components in certain instances, or it will impact how we can achieve certain components, or maybe it threatens certain components that we can't actually ever achieve a definition of privacy that we all agree with. So with this idea now of what ethics is and what is the technology that we're talking about, I move into what are some of the specific ethical issues that are related to robotics in healthcare. And I say at the beginning that at certain moments I'm focusing on the ethical issues related to artificial intelligence, and at other moments I'm focusing on ethical issues related to robotics, but I'll try and weave them into one another so that you get a broader picture of the complexity of these issues. Now, has anyone heard of the company DeepMind? Yes, great. So DeepMind is an artificial intelligence company based in the United Kingdom, over in the UK, in London. And in 2015, they ran the development of an app for testing kidney failure, or kidney disease. And in order to do this, they partnered with one of the major hospitals in London, and they collected the data of 1.6 million individuals. And they were not asking for consent to collect this data. It was assumed that patients would generally agree to the terms and conditions of this. And so this was one of the earlier examples where people started to perk up and say, what is going on? This raised a lot of questions about not only informed consent and having this discussion about the meaning of informed consent, data security, when the data is no longer in the hands of the public institution, but is now in the hands of a private institution whose main driver is economics. And it also raises the questions of the asymmetry in power. It is the companies that hold the secret sauce, all of the AI algorithms, and the capacity to collect all of the data, and they hold quite a bit of power. Governments are sort of in the hands of companies in many instances, so are public institutions. So this one experiment back in 2015 opened up this whole discussion about data, the acquisition of data, and the secondary usage of data, linking with concepts like informed consent and autonomy of the individuals. So one ethical issue that has been raised. Now, do you remember when the GPS system came out? And for anyone who's watched The Office, you know the main character, Michael, and he drives into a river because his GPS told him to do so. Amazing stories. You know, they don't actually, nobody has done that in the Netherlands, so I have to explain this is what happened in North America, that people drove into the river and think, wow, it's crazy. But it's amazing to think that, you know, the road is going straight ahead in front of you. A piece of technology tells you to turn left where there is water, and you drive your vehicle into the water, losing all, you know, practical judgment, not trusting your senses for actually seeing what's happening in front of you. So this is also happening in the robotic space. We now see experiments that are happening where you have robots that are used in emergency evacuation settings. And you have an experimental setup where a group of individuals comes in, the robot is there to interact with them in a certain way. The robot breaks down as part of the experiment. You have the person come in and say, sorry, the robot is broken, let me fix this, let me do something, leaves again. And then the experiment continues, and the smoke comes in through the doors, and the red lights are flashing. It's time for an emergency evacuation. You have people coming to exit the room. The robot is pointing you this way to a dark room with no discernible exit. The emergency exit is pointing you this way. Which way do you think everyone went? With the robot, yes, to the dark room with no visible exit, instead of following the instincts, you know, that we have been raised with. So we're already seeing examples of where people are trusting the technology, the robots, and in some instances, the artificial intelligence over their own common sense in many instances. This is an overtrust in technology, but it also raises the question of de-skilling. this idea that we lose certain skills that we may have been trained to have. And this was an important part of the conversation when surgical robots first came onto the scene, because what was it doing to the skills of the surgeon? Yes, they had to learn new skills, but were they still capable of fulfilling a surgery in the traditional way? Were they entirely losing those skills in exchange for these new skills? And this is sort of a broad question that we ask with robots in healthcare in general. What will it do to the nurse in his or her role? If the nurse is no longer there for lifting, for bathing, for feeding, what kind of skills is it that the nurse has? And when do they have the moments to actually develop and hone those skills? So de-skilling and over-trust of the technology, that's another issue that we're already seeing on the table right now. Then we are using, is a push to use artificial intelligence for the detection of skin cancer. And in May 2018, there was a large study that was done by university researchers in Germany and in the United States, where they surveyed and they used data from across the globe, and they found that the AI could actually perform better than dermatologists in many instances, showing whether it would be a malignant melanoma or a benign. And this raised the question about meaningful human control. I'm not sure if that phrase is common or is new in this context, but the idea of meaningful human control is, when will physicians, healthcare staff, when will all of these individuals be in a place where their decision is the one that sticks? And when will there be a situation where if the AI says to do something, that is what you have to do, regardless of whether or not your intuition tells you something else, right? So we have this situation where, and this is just one example, there's many examples of where there is the question on the table, if the AI or if the robot tells you to do something else, and in most cases it will be the AI, because its gift, its skill is to make these predictions. If the AI tells you to do one thing, but you would prefer to do another, is the hospital going to protect you in these situations? So this is very much related to the implementation and the policies and the guidelines around it, but it also gets at the root of, what are we going to use this for? In what instances do we think it's okay to have the technology provide an augmentation or an enhancement of the human in this sense? Now, going back to the concept of informed consent, I already mentioned that in the DeepMind situation, this was put on the table because of the data acquisition, the collection of the data and the secondary use. But something else that we have to keep in mind when we're talking about artificial intelligence is that the actual algorithm is somewhat of a black box. We don't know oftentimes how the algorithm works. Now, it's true that there are some companies that are trying to reverse engineer the algorithm so that the algorithm will actually point out what pieces of data it used to make its decision as a way of providing transparency or explainability. But in most cases, we don't know. It's a black box. So what does this mean for informed consent? If the physician doesn't actually know how a decision was arrived at, how can we ask for informed consent from the patient? And if the patient won't ever know how a decision is arrived at, is it fair to ask for informed consent in these situations? So that's the context when the AI is a black box, when the algorithm is a black box. But we also have to think about the other side of the spectrum of the technology, the robots. And we can see in many situations that now already robots in a healthcare context, people are becoming quite attached to them. And sometimes you have to take the robot away. But in most instances, individuals are becoming quite attached. And we are still learning about this attachment. We're still learning how it actually happens. Is it good? Is it actually bad? And so these are the kinds of questions that we have to put on the table when we talk about informed consent when interacting with a robot in a hospital context. These are vulnerable individuals in a morally charged context. What should informed consent look like when we're talking about humans interacting with robots? And for this, it's more commonly robots that are the companionship ones, right? The ones that are trying to form a relationship with you rather than the ones that are seen as strictly instrumental. Somebody else had raised the question when you were doing the creativity exercise about how can these technologies be available for everyone, right? And distributive justice is a huge ethical issue that needs to be on the table. Who are we making these technologies for? And what will be the divide between the haves and the have-nots? So to to sort of paint it in a different picture, I was struck on my way over here. I was flying, and I was looking at how the airline that I was flying with, if you were an elite member or you were flying business class, if you had the money, you got to go through a different line, which was much shorter, and you had humans there to lift up your luggage and put it on the conveyor belt and to greet you and, hi, how are you, have a nice day. If you were an economy passenger, just the average individual, you went to the really long line where it was just conveyor belts and you had to lift and lug your luggage and put it on. So there was a very clear divide here for the individuals who had the money, who had the means to pay for it. They got human contact. They got really great personalized human contact. But if you didn't have that money, you interacted with a machine. That could be frustrating, and if it broke down, then a human came to help you. But it was a very different situation. And this is something that we have to talk about when it comes to the acquisition of goods or distributive justice in a healthcare context. Who is going to have access to this technology? Will it be the people who have the money that get this really nice, friendly human touch? And if you don't have money, you only interact with machines? Or will it be the other way around? That if you have a lot of money, you get all of the fancy machines, and if you don't have a lot of money, you will have the human contact that might be subpar. I'm not saying it would, but it could be painted in that picture. So distributive justice, this is a huge issue, a core of the domain of ethics that has to be addressed when we're talking about the design, the development, and the use of robotics and artificial intelligence. So up to this point now, so we've started with robot ethics back in 2005, let's say. Ethics of artificial intelligence is even newer. We're talking just in the last few years. But we're starting to build a list of ethical issues. So all of the ones that I had just mentioned: de-skilling, data security, privacy, informed consent, power that the companies have, and whether or not that gives us real choices in the situation. But because we're at such a new time in this situation, there are new ethical issues that we haven't even thought about yet, right? There's also issues that we're just starting to scratch the surface and to question, could this be something that we have to take into consideration? So one of those has to do with the testing of the products or the performance of the products. And right now there's a whole domain of research in the robotics world called human-robot interaction. And it focuses on how the human and the robot interact, surprisingly enough, right? The title gives it away. But the idea is that you look at one human interacting with one robot. And what we need to understand in the healthcare context is that, yes, there could be instances where it's one human and one robot, but the robot is a part of a much larger system. The robot is the instrument for the provision of care from the system or from the healthcare provider. So we need to change this way of thinking that it's just human and robot to understand the complexity of the care system, that this robot will be, or the chatbot, will be used to connect us with another care worker, will be used to replace another care worker just for a task, and then we have to figure out how the rest of the system gets integrated into this human-robot interaction. So we need the academic studies to understand the context, to understand what's actually happening. And this morning's talk was wonderful about what one university is doing to put this on the table, to make this a reality. But we need to do this on a much larger and broader scale. And then we also have to ask, what is it that we want to use the robot for? And should we be using the robot for this? So coming back to this should question. Now, there's a lot of talk about using robots in the care of elderly persons. This would allow them to remain in their homes longer, would provide them with more autonomy. But there's also this push to try and use the robots to combat loneliness. And so over in the UK, we talk about the loneliness epidemic. And there's actually a loneliness minister. And this is something that even in the Scandinavian countries, there's a lot of talk about people are just in general lonely. And of course, I mean, there are health outcomes to this as well, right? The stress that it can cause on individuals. And so there's this push that maybe if we have robots, people won't be so lonely anymore. And this is one instance where we really have to question, yes, it's possible that we can do this, right? We can create the ultimate robot that minimizes loneliness. But should we be doing this? And it might not sound so sexy. You know, the robot is this really cool technology, and this one is super cute. This is the Now robot that they do a lot of testing on. But maybe this is an instance where technology isn't the solution to a social problem. Perhaps. And then what other kinds of solutions do we have to look for? So it's about understanding exactly what it is we're trying to target to use the robot for. And then another topic that's only recently being put on the agenda is this idea of touch between the human and robot. And I was really inspired about the concept of touch when I was meeting with all of the nurses back in the United States and learning about therapeutic touch, instrumental touch, healing touch, all of these different kinds of touch that in the academic community we don't have the same language, we don't understand this, but this is really important for roboticists to know about. And we also need to survey and to talk to the roboticists to see what kind of touch are they designing for if it's a robot in the healthcare sector. And so a colleague of mine actually here at York University and I are trying to now dig deeper to say, there is this field of tactile human-robot interaction. It's a whole field of study looking at how we can safely interact with robots, but what we need to do is to go further and to understand the significance, the ethical significance of what it means to touch a robot or to be touched by a robot. So there are some times, when a friend might come over and put a hand on a shoulder, or someone in the healthcare context might put a hand on the face or knows how to touch appropriately, and that can give so much meaning to a patient. It can change their state, it can lift their spirits, it can calm them. What does it mean if a robot does that? And then going back to this should we be delegating that kind of role and task to a robot? And this is where we have to have a conversation about these different kinds of touch. Maybe we want to say robots should only do the sort of instrumental therapeutic touch, but the healing touch is something that we leave for human caregivers. Or maybe we want robots to do all of the different kinds of touch just to see how it goes. That's also, an option, but it's important for us to raise these questions, to put it on the table, and to have a democratic debate about how we want to go further. Okay, so that was getting into, listing off, and this is by no means an exhaustive list. There are a whole range of ethical issues that we could discuss, but I also wanted to point the direction or pivot the conversation in a different way. So not only addressing what the ethical issues are, because I also understand that's like, we can feel defeated if we talk about that all day. Oh my gosh, there's this and there's that we have to think about. But now the important question is, what should we do about this? What can we do about this that conforms to the ethics view? And we have the legal system in some instances that can help us. Over in Europe, we've just established the GDPR, the General Data Protection Regulation, and this is to ensure the protection of people's data. So all data, whether it's in a healthcare context or not, you have to give consent for the use of the data. You have to adhere to the principle of minimization, that you only take the minimal amount of data that is required for the study or the project that you're doing. So there are things that we can do in the legal system, but ethics provides a different tool, a different resource. It allows you to go beyond what the legal system tells us we are allowed to do, and it allows you to go back to this vision of the good life. Where do we want to be 5 years from now? What do we want to be the defining criteria of AI in healthcare, and how do we get there? So we need ethics to work together with law, to work together with engineering, to create the healthcare bots of the future. And I say bots here because I'm taking in that entire spectrum. The embodied robot that is actually physically interacting with us in the world, the avatar that we're still interacting with but isn't embodied in this world, and the chatbots or the AI algorithms that are still bots, so to speak, in a certain manner. So this is where ethics for innovation comes in. This is where we get to, instead of just listing off all of the ethical issues, how can we take this and do something with it? How can we use this to fuel design? Well, something to remember about ethics is that with ethics, timing is everything. So when I was talking earlier about, the ethicist has this sort of finger-wagging persona at this moment, or that ethics is stifling innovation, that's because ethics comes in at the end of the design process. You've already made the product. You've already invested all of this time and all of these resources and money, and then you have an ethicist come in and say, you didn't think about the privacy issues or where the data is going to be stored. Is it in the cloud? Is it going to be in a sort of black box? But if we can include ethics much earlier on in the design process, then that allows us to take those items into consideration early on so that the resulting product is one that conforms with our ethical standards. So what this might look like in practice, you consider your normal or your average design process. You have your product goal, your finance, your market competition, complying with laws and regulation, because ethics and law are different, right? Ethics is definitely the foundation for law. It stimulates the creation of laws, but there are some things that you can do legally, but that are still unethical. Anyway, so you incorporate your law, your regulation, and then you have your end product. And then after your end product, you realize, ooh, we're creating this product that we might be encouraging a kind of overtrust, or we're not clear on the delegation of responsibility. So the child is sharing things with this teddy bear, and we have all of this data collected. And now are we going to share it with a private company, or do we keep it here in the healthcare system? So there's all of these ethical issues that happen after the product has been made. And in this particular instance, this is one example. What we need to do is to have a discussion about ethics right at the very beginning, about when we're just starting to discuss what is the product that we're trying to make. And in the healthcare space, we still need to figure out what that end product is going to look like. In a space outside of healthcare, an example of what this could look like is something called the Fairphone. Now, the Fairphone is a Dutch product, and this is an alternative to a smartphone. So the Fairphone uses only materials that are procured in an ethical way. So they've actually they've created a new procurement chain for gold so that they are not exploiting individuals, so that they are not endorsing any kind of slavery or child labor in the procurement of these minerals. So they've changed the way that you can actually collect materials. And also every piece of that phone is replaceable. So if your screen breaks, you can order a new screen. If there's one part of the phone that breaks, you can replace that individual part without having to buy a new phone. So the idea is sustainable, cradle-to-cradle kind of development and process. And this is the kind of thinking that we need to do with healthcare robots. We need to start with what are the ethical issues that we want to address? What is the vision of the good life in healthcare? And that, bringing in the idea of compassion, how do we create technologies that can enhance our compassion? That is what the development process has to look like. So the other thing, though, that has to do with timing of ethics when we incorporate it. But the other thing is about what ethics actually is in practice, that ethics isn't just a sort of code of conduct or a checklist, that you can do ethics once and then you're done. You're good to go. You're golden. Ethics is a verb. It's very much like character development. It's this ongoing process. And the reason why it needs to be seen as an ongoing process is because the speed of the technology, right? We're talking AI, from one day to the next. There's been a new development or a new algorithm that has provided us with new capabilities. We need to understand how quickly the technology is moving, and we need to understand that that raises new ethical decisions. Should we delegate this role or this function to the technology, or is that the kind of thing that should remain in the hands of the humans? So because of the fact that the technology is changing so quickly, that we are confronting ourselves with all of these new decisions and ability to delegate to the technology, we have to keep up with this kind of reflection or this creativity that we did earlier this morning. So what does this look like? What does ethics in action actually look like? Well, we can see that there are multiple layers to envision how we can have this kind of reflection or stimulate innovation that requires ethics. We can do this on an institutional level. We can talk about ethics guidelines for a country, right? So Europe is creating their ethics guidelines for artificial intelligence. This is one way of adapting principles on a larger scale. The bioethics principles actually are very providing a useful tool for how we might think about artificial intelligence. But this is a very, abstract or top layer. It allows for guidance, but it doesn't tell you what to do at the nitty-gritty instances. Then you can also consider ethics education. And in the Netherlands, all bachelor students, all undergraduate students have to have one component of ethics in their studies. So we're starting to place this emphasis that as you go throughout your education, and oftentimes it is these engineering students that are creating the technologies that will be used in healthcare. So we want these students to have this component of reflecting and thinking about this concept of the good life. How do they materialize it? How do they translate that into actual design requirements? But it's also important to understand that it's not just educating the people that are making the technology, also the people that will use the technology, the patients and the general public. And one of the things that we do at the Foundation for Responsible Robotics is we write consultation documents. So we try to write documents that are accessible to the general public, where they can be informed about the latest robotics innovations, and they can make choices about whether or not this is something they want to apply pressure on policymakers, or whether they would like to abstain from being a part of the conversation. But either way, it's important. Education is an important function for realizing ethics in the real world. And then this last one is ethics and design. And what I mean by this is oftentimes, you have a design team that's working in a company or in an academic setting, and you have all of these different expertise that form the design team, right? Everyone's talking about interdisciplinary or multidisciplinary design teams, the engineers, the project manager, the graphic designer, the finance, marketing, programmers. But what we need to do is to now incorporate an ethicist as part of this design team. We need someone who is committed to the values advocate, someone who is constantly making sure that this becomes a priority at the table, so that ethics becomes embedded in the actual design process, whether we're talking about academia or industry. And now industry is actually picking up on this. Some of the largest companies, AI companies in the world, are now hiring ethicists to be a part of specific research teams, or to act as this ethics resource on a part of a design team. So it's not just something that's happening or is necessary in academia, but also in industry, and they're going with it. And the reason why this is so important is because when we think about some of these ethics concepts, like responsibility, this comes up quite a bit. Well, there are so many different ways of thinking about responsibility: causal, legal, forward-looking responsibility, backward, retrospective-looking responsibility, individual responsibility versus collective responsibility. And so we can't possibly think that engineers should be tasked with having all of this knowledge and expertise. This is what the ethicist is supposed to do. And this is part of the contribution that they bring to their team. They say, yes, we need to be focused on responsibility, and we need to decide which form, which manifestation of responsibility we want to program or to embed in this technology. So really what it's about is taking these values, these often very abstract values, providing a conceptual analysis, providing a way to understand what they mean in practice, and looking at comparisons between one definition and another, and then helping the team to translate this into the actual requirements or the capabilities of a robot or an artificial intelligence system. So in general, just sort of wrapping up now, where I started was talking about the fact that we have this technology out there, right? I said $1.9 billion in 2017 on just healthcare robots, and that doesn't include artificial intelligence. Those are statistics from the International Federation of Robots. So we have the technology out there. We're already seeing, whether it's the narrative or the rhetoric that we hear coming from the media, or whether it's you in your own experiences interacting with the technology, we see that there are some ethical risks. There are risks to this conception of the good life. There are risks to certain values like data security and privacy. And the question is, what are we going to do about it? How do we mitigate? How do we overcome these risks? And my suggestion is that we take ethics as a resource to help us overcome, to help us mitigate these risks. And the two things that we need to remember in order to do this, in order to put this in action, is the first, the timing of ethics, that we need to start to have these discussions at the very early stages of the design process rather than afterwards, once we've made the technology. And the second thing is that we have to remember that ethics is this continuous action. It's a verb. It's not something that we can just sort of check off our list and say, oh, we did it. We thought about ethics today, and now we're done. We can go home and all rest assured. It's something that we need to keep up with, because as we create new algorithms, as we create new robotics, they are going to push our ethics to the boundary, and we need to make sure that we are engaged in this continual reflection. So with that, the goal, again, the take-home message that I want to leave you with is, only when we start to do this and to really pay tribute or to commit to this idea of the good life and what this means in healthcare, what this means for patients or for the people working in the healthcare system, we need to change this narrative that ethics is there to just say no to technology. And instead, we need to use ethics to steer development, but also to stimulate the kinds of developments that we want, the kinds of technologies that we do want, and the kinds of technologies that we don't want. So thank you very much for your time. Thank you for inviting me today, and I'll take any questions you have.